In today's To Your Well-Being, we're talking about our veterans. So head over to our app and vote now and let us know if you're a veteran or have ties to one.
Our veterans sacrifice their lives and their time with their families to serve our nation and protect our freedoms. And it's not easy. Many times veterans can return with varying health issues, and it can be hard for them and their loved ones to cope. So we're joined now by Jolene Cannady, a nurse practitioner at Chrisman Family Practice, to talk about more about the things that these veterans face and how really we all can help them.
Yeah, and Jolene, some veterans, face more challenges than others simply by where they served. So can you talk about some of the issues that they may be facing?
So I think if to start out, I would have to talk about the Vietnam veterans. The most popular exposure that we have there is Agent Orange. This is the one that we talk about the most. And so with Agent Orange, we see a lot of cancers, we see type 2 diabetes, and a lot of chronic disease processes based on their exposure to Agent Orange. If we go forward, the Gulf War veterans, we have Gulf War syndrome, which is a lot of GI symptoms, a lot of headaches, chronic fatigue, memory loss. We also see various neurological diseases like multiple sclerosis, ALS. And then if we go forward even more, our current veterans, we have exposures to explosive devices, so a lot of traumatic brain injury, which can cause short-term memory loss, and then also some mood disorders.
So you're talking about a long range list of issues over spanning decades. Let's also talk about when our veterans come home, something to be celebrated, but there could be some challenges there as well.
Definitely. So one of the things that I do a lot of research on is military to civilian transition. So we know that a lot of soldiers start out less than 25 years old. So that's a time when your brain is still developing, they're still learning and growing. And so when they enter the military, it's a very rigorous and structured environment. And they have a very specific role to take on, and they develop a family among the other troops. And so when they come home, it can be very difficult for them just because they are entering environments that's not as structured. They don't have as many, there's not as much rigorous stuff going on, and then they don't know their role anymore. Like, it's difficult for them to find a new role in a different environment. And then people don't always, they lose some of their family, that soldier family. And not everybody really understands how to approach some questions to ask. So it can be very difficult for them when they transition.
And we know a lot of people, when they do come back, PTSD is a major thing, post-traumatic stress disorder. What is it, and what should you do if you think someone is struggling with that?
So post-traumatic stress disorder is an anxiety disorder, and it's something I always like to tell people. We don't just see it in veterans. We do see it also in people who have had sexual traumas, people who have even had cancer treatment, cancer diagnosis, or been in major car accidents. We see it in a lot of people. So PTSD can come with symptoms like extreme anxiety. People can be very hyper-focused. They can even have a little depression. There's lots of different things. They have flashbacks, nightmares, different things that we pay attention to. And so the big thing is to understand what's going on and to really pay attention to the veteran or the soldier when they return home and look for those symptoms. There's lots of resources out there. The VA itself has lots of resources. There's the Veterans Crisis Line, which is a wonderful area where you can call, families or veterans can call. And then there's a new app called Operation Pop Smoke, which I really like. And it's a way where veterans can get connected, and so they can talk to each other and build that support, which I really think is interesting.
And we're also asking you how you are tied to Veterans Day. A majority of you, at 40%, say your parents served, followed by I served at 25%. So keep on voting on our interactive poll today.
Yes, and we do thank you for your service. Those of you who have served, and Jolene Cannady, thank you so much for joining us today.
Thank you for your service.